So I wanted to just shoot a brief video. Hi, my name is 𝗘𝗅𝗽𝗋, and I wanted to shoot a brief video about statistics. Did you know? Well, let's see. There's two stats that I wanted to throw out there. In 2021, there was a study done, basically a multi cross study of studies around the world. I'm sorry, it's escaping me, but basically what they found was men between the ages of 18 and 87, roughly 21.4% suffer from erectile dysfunction. However, as we get to the age of 40, that number goes up percentage-wise up into the 40%, and that was a study that I think was done in 2024. I say all that because it's important to understand that erectile dysfunction doesn't just happen to men as we're aging. Yes, it is can be part of the aging process, but we are starting to see young men as young as 18 that are now experiencing erectile dysfunction, and we don't necessarily understand why that's happening. What we do understand is that perhaps there's an influence of testosterone or lack of testosterone, and that's not a topic for this particular video, but we know the role of testosterone is specifically geared towards lots of systems in our body, but for men particularly in erections and sexual function. And so perhaps there has been a decrease in testosterone, and that is in turn leading to less, I guess, erectile dysfunction becoming higher. Sorry for that. I just had a brief lapse. But my point was, you're not alone. And that's what I want you to understand. When you look at it statistically, to think that 24% doesn't sound like a lot, but for every 100 men, that means 24 men experience erectile dysfunction to some extent. And then when you get into the 40s, 40 men out of 100 can experience erectile dysfunction. And there are different severities, and I won't get into that today. I just wanted to share the statistics with you because I think it's important to understand that you're not alone. You know, erectile dysfunction is something that's very personal. It can be embarrassing, especially if you have a lover or a spouse, and you know you're not happy, they're not happy. And so I just wanted to shoot this to let you know, number one, that you're not alone, but two, there's help. And that's where shockwave therapy comes in. That's where working on pelvic floor musculature comes in, whether it's strengthening the muscles or loosening the muscles. So I hope that helps. I just wanted to shoot a quick video, let you know you're not alone and there is help. I hope that helps. Thanks.